Good morning, everyone. Thank you for joining us today. I'm Donna Chow, your host and your moderator for today's event. Today's webinar is recorded and presented by Lotus Institute of Integrative Medicine. And here at eLotus, we have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CU content. On behalf of eLotus, I want to thank you so much for being here today and choosing eLotus as your CE provider. Dr. Henry McCann is one of our favorite Master Don't instructors for his clear and to-the-point teaching style. He is extremely generous with his knowledge, but I'm sure most of you guys know that since this is the reason why you might be here today. So before we begin, I would like to cover a few housekeeping topics. The webinar will run from 9 a.m. to 6 p.m. Pacific time. There will be a 1-hour lunch break from 1 to 2 p.m. and 2 short breaks in the morning and 2 in the afternoon. And we'll let you know when that is. And what you are seeing on your screen, if you're using the app, you are able to control on your own. So you can choose to make the PowerPoint slides bigger or the video bigger. It's up to you. And if you plan on chatting with the attendees, please note that Zoom already sets it for you to chat with the panelists only. That means it's just the moderators and the hosts. But if you want to chat with other attendees, make sure to set it to all panelists and attendees. That way, when you ask a question, maybe someone else who's also attending the class can help answer it for you too. And if you are here for CEUs, be sure that you are here for the entire day. And also, I did receive a lot of questions about the quiz for yesterday's class. As a reminder, these people may have missed yesterday's announcement at the end of the class, but the quiz is always available the next day now. So for today's class, when the class is over, that's when I can get the attendance. And then once I get the attendance is when I can verify who is eligible for the quiz. So with that's why it will be the next day. So you can just take the night off and think about the quiz next day. It's not even that hard either. If you're attending the class and you're into the material, you should have no problem at all. Plus, there's also the 4-week video replay, which will be ready on Monday. And for that, I'll send an email out as well. If you have any questions, just let me know. Also, if you have any questions, please email me instead of the chat room because the chat room goes by so fast. I miss these questions. Sometimes I may be helping someone else, so I'm not glued to the screen. You can get my attention by emailing me. And if you email me, I got it. All right. So today's class is Tung's Acupuncture and Herbs for Stress and Digestive Disorders with Henry McCann, in which participants will learn his tried and true treatment strategies for stress and digestive disorders. Participants will also learn an introduction to Morita therapy, a Japanese approach to psychology that can help guide patient management in the clinic. All right, let's begin with the intro. Dr. Henry McCann is the author and co-author of Tung books, Pricking the Vessels, Bloodletting Therapy, and Practical Atlas of Tung's Acupuncture, respectively. He earned his diploma from the New England School of Acupuncture and his doctoral degree from the Oregon College of Oriental Medicine. As part of his doctoral studies, he interned at the Chengdu University of Chinese Medicine in Sichuan, China. He's also faculty member at PCOM New York and other doctoral degree programs in the U.S. So at this time, let's go ahead and welcome Henry. And if you're able to share your screen as well, so we get the PowerPoint.
Okay, let's pull this up.
My email is info@elotus.org.
Okay. All right. So you should be able to see the PowerPoint now. Let me get the slideshow started. Good. Okay. So welcome, everyone. Thank you all for coming today. Let's see if I can pull this up. I noticed certainly some people are here back from yesterday. How many of you, just to get an idea, you can type in the chat room first. Okay. So first, some basic housekeeping. If you're typing in the chat room and you would like both the panelists and attendees to see the discussion, you need to make sure you set your to in the chat room where it says type message here. You have option of all panelists or all panelists and attendees. Otherwise, if you send it to panelists, if you send it to panelists only, then only those of us who are panelists, Donna, myself, Sam, people on this end of it will see it. So if you have a question that we're asking, then put it into all panelists and attendees so other people can see the question as well. I also know that we're in the middle of an unprecedented global pandemic, which is sort of really grabbing everyone's attention, certainly. I would ask, however, that since today the topic of discussion is not COVID or the pandemic, please avoid discussion of that kind of material in the chat room. We had some yesterday. It became a bit disruptive in the morning, and a lot of people were having a hard time focusing, including myself. So if we have questions related to today's material, that's fine. If you have questions related to COVID, there are a lot of great resources. Donna, maybe you can, I think there's a link to some resources that eLotus has. Donna maybe can post that link to everyone, or go on Facebook and discuss it there. So, but since it's not the topic of today's, and I know it's hard because it's on everyone's mind, but let's try to avoid that sort of topic for the time being. I'll also try to get to questions as we go through the material. Donna can also try to collate some questions in case I miss some interesting questions, and hopefully we'll get things covered. All right. So today, compared to yesterday, is we don't have quite as much material to potentially go through. So I think we can take a little bit more leisurely pace than we did yesterday, and we can go through some other interesting ideas. So we're basically splitting between two topics. The first one we'll look at is stress management. We can talk a little bit about fasting, perhaps, when we get to digestive. I myself, if those of you who know me know that I'm a fan of intermittent fasting. I do fasting myself quite regularly, and it's something that I find useful for myself. But we'll see if we can chat a little bit about it. I don't know if I have a whole lot of really great insight to offer, but we can bring up some of it. So the first part today, we'll be talking about stress, and we'll look at mind, affect, and some basic ideas related to what are called essence spirit disorders, Qing Shen Bing, essence spirit disorders in Chinese medicine as treated with Tung's acupuncture. One of the things that I see frequently, and it came up yesterday actually in an early question yesterday, was this idea: does Tung's acupuncture treat spirit, treat mind? And I firmly believe that all acupuncture systems treat both mind, physical body, etc. Right? Because it's not necessarily something that's separate. Since they're integrated and one affects the other in a very real way, we can't not treat the mind. So all acupuncture systems, I think, are equally as effective. Certainly some acupuncture systems market themselves as being better able to treat mind or spirit. But I'm going to tell you, and I firmly believe this, and as I say this yesterday, you can try to change my mind, but you're not going to, that this is just marketing. So some acupuncture systems, because that's what they like to focus on, market themselves as being better at treating the spirit, the mind, whatever. But it's just marketing, right? It's just marketing. The other thing I will tell you, and I firmly believe this as well, because mind and body are thoroughly connected, you can never ask a patient about their mind state. Ask only about their physical state, and treat their mind state equally as well as if you ask them about it. I'm not going to suggest to you that you don't ask about your patient's mind state. I think you should. But if we do believe that there's a thoroughgoing connection between mind and body, treating body by itself and putting it back in a better state of balance will also balance mind affect. There was, who was the back pain guru in New York City? Was it Dr. Sarno, I believe, right? Dr. Sarno, and I got his name wrong. Some of you may have read some of his books. He basically treated back pain. He was a regular MD, but he decided at some point in his career that treating back pain was best done through treating people's psyche, basically. And he said, don't do acupuncture, don't do physical therapy, don't do drugs, don't do surgery, just work on mind state. And if you can treat back pain through the mind, you can treat the mind through treating the back pain, right? because it treats everything on all levels. So I think it's a big mistake, and it's basically because of marketing. On those of us who teach Tung's acupuncture, perhaps it's our mistake in marketing, that we market this as like fast pain relief, because it works really well. I mean, it's one of the best things I've ever used for pain management. So people assume that Tung's acupuncture is for pain, but I use it in my clinic for internal medicine, for psyche, for everything, and I would encourage you to consider this possible as well. So this is the kind of thing we'll talk about for the beginning. I'll also give you an introduction to Morita psychotherapy, and I'll give you some resources to find out more information later on if you're interested in doing that and reading more about it. This today will be just a bit of an introduction, and I'm going to present it as an introduction because I do believe that some of the concepts and ideas are very useful in the clinic and can be applied. I'm not a psychotherapist, right? I'm not a psychotherapist. However, I tell my patients all the time, I'm not a therapist, but I play one on TV, because, if you're practicing acupuncturist, you're going to be basically a psychotherapist part of the time for a lot of your patients, and that's okay. All physicians of all sorts will have to deal with patients' emotions, their mind states, because it's part of being a human. That's just the way it is. But I think the lessons of Morita therapy can help sort of give us tools and strategies to deal with patients. And there are a lot of deviations between Morita's approach and the approach of some conventional Western psychotherapy systems. So some of the ideas may be challenging. I'm not going to suggest to you that you have to believe everything I say. I'm just going to suggest to you that you keep your mind open in terms of accepting this as one method that's been used successfully by thousands and thousands of people to help people deal with mind affect. And I use concepts of Morita therapy in my clinic very, very frequently, really on a daily basis. And I find it a wonderful adjunct to what we do. One of the classes I teach at PCOM, which is now Pacific College of Health and Science in New York City, is an elective course on emotional and spiritual healing in Asia. And my goal for the semester is to never once mention acupuncture, herbs, or anything else we do, because there is a world of material out there of working with mind affect that has nothing to do with the conventional therapies that we usually apply. And my strong opinion is that as people practicing Asian medicine, these are things that we should all be aware of and potentially studying and utilizing as well in our clinics. I think that they really can significantly add to our therapeutic regimen when we're working with people. Okay, and then we'll talk about digestive disorders. So we'll do that. So just while I'm here, how many of you are new? This is your first time doing a class on Tung's acupuncture. If you can just go ahead and type into the chat room, you can type new or something, or me or something like that. I'm just curious who we have here. Okay, so second day. All right, so one of the challenges is that for this type of class here, we're going to get a mix of people who are very experienced with Master Tung's acupuncture, and then we'll be working with people who are fairly new, fairly early on in the system. So what we'll also do is do a basic review. I think I end up doing it pretty much for all of my eLotus classes, because I'm never sure who's going to see this, or in the future who's going to see the video. So we'll also do a basic review of core concepts. So here we go. Let's get started. So first, just a little bit background about stress, since it's the first topic we'll be dealing with today. Certainly stress is a normal thing, right? And not all stress is bad, right? So different sorts of stressors are actually oftentimes useful for the body. So that said, stress can be useful and helps with adaptation, and stress can also become overwhelming and pathogenic. For example, early on in the pandemic, I was had a lot of time on my hand, like most of you did. So I'm thinking, okay, what can I do with myself? So that's kind of new and different. So I started reading about a couple of different systems of working with breath, with body. And since April, I've started taking I've done cold exposure. So I do cold showers every day. So every day I do at least 4 minutes of cold, and I go right into the shower cold before I even turn the warm water on. It was awful for the first month, and then you get used to it and your body adapts. And I've noticed that my body adapts throughout the day in terms of the temperature. Even when it's getting colder now, I'm much less cold sensitive because my body is learning to adapt to temperature changes. So that's a type of a stress, right? So it's a stress that I do in a controlled way that hopefully has a potentially positive outcome at the end. Something like intermittent fasting, which someone asked briefly about. This is a type of stressor on the body. The body would rather eat, honestly. Our natural inclination is to eat things because we're living animals that want to survive, and we survive by eating things. However, certain types of controlled stressors can be very useful for one's health in many ways. So stress is a normal thing, and stress is a normal feeling. It's one of the things that we experience in our body that helps with survival mechanism. However, the problem we're going to talk about are these long-term stressors. And this is a quote from the National Institutes of Health that says clearly that long-term stress, especially stress that we don't have strategies to manage in our own bodies, can worsen and contribute to a wide range of health conditions, right? So even when we're looking at the digestive conditions later today, many of those digestive conditions may be the same as caused by stress. So this is the sort of thing we're going to be talking about. Clearly, I would say that 99% of my patients come in and there's some sort of stress component in their case. Maybe not 99%, but a lot of our patients are dealing with something. And sometimes they handle it well, sometimes they're not handling it so well. But I do think that our patients will do better with some sort of treatment. So this is from the Mayo Clinic. These are, and you have the citation there if you want to go read the entire article. These are some effects on the effects on our body that stress can lead to. So we can have somatization of stress, whether it be pain presentations, we can have mood, we can have behavior changes. So even when we're looking again at pain management, when we talk about pain management as a topic, pain management conditions can be stress-induced as well. So if we have stress headache versus other types of headache may not necessarily be treated differently in Chinese medicine because we're looking at the same dysregulation of qi and blood in the channel and organ systems, right? So when you're looking at pain management classes, that can be applied with stressed patients. We're looking at digestive cases, that can be applied with stressed patients. We yesterday in geriatrics talked about insomnia. Clearly insomnia, which we'll talk about again today, can relate to stress. So stress overlaps many different arenas. So it's something that will be relevant, I think, to all of us in our clinical practices. Let's talk a little bit about the mind in Chinese medicine. This comes from the Shanggu Tianzhen Lun, which is the first chapter of the Su Wen. This is the first book of the Huangdi Neijing, the Yellow Emperor's Classic. This is one of my favorite lines, I have to say. And, I keep on thinking I'm one of the only people I know who doesn't have a tattoo yet. So I'm thinking, what can I tattoo on myself? I haven't come up with a good answer yet. When my son's second grade teacher years ago had a tattoo, I thought to myself, I'm missing out on the trend. I'm thinking maybe I could get a line from the Neijing tattooed on me. If I ever did, which I probably won't, this would be one of the lines. This is one of the lines that I chew on quite a bit. And it's really beautiful. Here it is. The depletion evil and the robber wind, there are specific times when to avoid them. Quiet, peacefulness, absolute emptiness, and the true chi follows these states. When essence and spirit are guarded internally, where can a disease come from? Right? And this about sums it up, in my opinion. So let's just take a look at this and analyze it a little bit, because they're saying some interesting things. So first of all, the depletion evil and the thieving wind, or the robber wind, the Zeifeng. These are two technical terms in early medical literature. So the depletion evil is a disease evil that comes into the body by virtue of there being some sort of depletion internally, right? So again, this is the first chapter of the Su Wen. This is the very first chapter. So if people have some sort of depletion in the qi and blood or something of that sort, that allows an external evil to invade. That's a depletion evil. The robber wind or the thieving wind is that evil or that disease presentation once it has taken a life of its own, once it's inside, continues to wear away at the upright, at the vitality, right? So that's depletion evil and robber wind. Now, quiet peacefulness and absolute emptiness, right? What do we see here? What are the causes of disease in Chinese medicine? So everyone think back to your basic TCM class. I taught basic TCM theory at PCOM for a number of years. What are the three categories of disease causation? Anyone remember? You can type into the box if you remember. Someone's got to be a brand new student out there who's just in practice, who actually remembers what they studied in school. All right, if you don't remember, don't worry about it. So there are the interior causes of disease, exterior causes of disease, and the miscellaneous causes of disease, right? The interior causes of disease, and by the way, usually in TCM, it's exterior, interior, then miscellaneous. In the original articulation of this from, I think it was about 1,000 years ago, they talked about interior first and exterior second. So the interior causes of disease are the 7 affects, right? The 7 mind states. The exterior causes of disease are the 6 disease evils, the 6 external evils: wind, cold, heat, summer heat, dryness, and dampness, right? Those are the external causes of disease. And just as I mentioned yesterday, the 6 and 7 are symbols of something, right? Let's have a moment of honesty. Really, summer heat versus heat, or fear and fright versus worrying and overthinking? Come on. 6 and 7 are symbols to help us get our mind around what it is we're trying to present. And that we can have a discussion. Come visit me in New Jersey. We can talk over tea about the symbolism of numbers in these early pieces of writing. But back to this passage, we see both of these here, right? The depletion, evil, and robber wind, exterior patterns. Quiet peacefulness, absolute emptiness, the true chi follows, interior patterns, right? So the quiet peacefulness, absolute emptiness, the true chi follows these states. This brings us into the heart of that idea of mind and affect as major causes of disease. And so later on, in that first chapter of the Suen, we also see that they spend quite a lot of time on mind states, right? And so the first chapter, this is the same chapter that gives us a cycle of 7 and 8 is aging, that talks about why people live to 100 or why people live to 50 instead of 100. A good portion of this chapter, and it doesn't mention acupuncture once, doesn't mention herbs once, it all mentions lifestyle and mind affect. So in Chinese medicine, this really becomes, I think, one of the core issues that we have to deal with our patients, because this is humans. We're 2,000 years ago today, we're still living in the same human bodies. Okay. Let's talk a little bit about the heart in Chinese medicine. So here, the heart is the office of the enlightened sovereign. When I translate this, I like to translate this as the enlightened sovereign. And why is that? Because the first word here, so the third character for those of you who read the Chinese, this is the character Jun as in the Junzi, or like the Si Junzi Tang, or the Liu Junzi Tang. So the Junzi we usually translate in English as a gentleman, but within Ruist philosophy, or Confucian philosophy, although I'm trying to get away from the word Confucianism only because it was a term created by Protestant missionaries in the 1900s for the purpose of proselytization of Chinese. In Chinese, they don't call it Confucianism, we call it Ruism, basically the study of scholars, the Rujia or the Rujiao. So in Ruist philosophy, the Junzi is basically the person who's cultivated, the person who's, it's not exactly the same as Buddhist enlightenment, but for lack of a better way of putting it, enlightened. So the heart is the office of the enlightened sovereign, right? And heart is this place that houses our consciousness, our ability to relate to the outside world. So for those of you who've seen me lecture before, there's a famous quote from the 74th chapter of the Suen that says, heaven and earth are the great principles. Then it says, Ren Shen Zhi Tong Yin Ye. So the human Shen penetrates and reflects it, right? Why is it that it's not the body penetrates and reflects it? Why is it that the Shen penetrates and reflects it? This is a question that deserves all of our consideration on a very deep level. And we can't answer it today, but again, welcome to come to New Jersey. We'll have tea, and I have a guest room. You can stay and we can chat about it for a weekend and come up to this idea of why is it the Shen that penetrates and connects to heaven and earth. So heart and Shen and consciousness, this is a big deal, right? As human beings, we are creatures of spirit embodied in flesh, right? So we have both heart and kidney, which represent that spirit embodied into flesh, which is why even those of you who like to do trigrams, right, as symbols of yin and yang in our body, the trigram for kidney is the kan trigram, the kangwa, the water gua, which is two broken lines on top and bottom and a solid line in the middle, which is a symbol of Mingmen, but also a symbol of consciousness embedded within physical form. So after that, this chapter here, and this is the Linglan Midian Lun, this is chapter 8 of the Suen. Then it says the Shenming Chuyan, the Shenming, or the spirit brilliance, originates in it. So according to Zhang Jiabin, who's a very important commentator, he says that the Shenming here is basically the faculties of mind. It's intelligence, it's wisdom. That's what we're talking about here. Now, in case you thought that was enough, and this is a chapter in the Suen that gives us the heart is the enlightened ruler, the lung is the minister of state, the gallbladder is the central rectifier who grades the scholars' exams, the liver is the general, et cetera, et cetera. That's this chapter here. We all think, okay, this is a chapter about all the 12 organs, right? But really, it's a chapter about heart. Why do we know it's a chapter about heart? Because later in that chapter, we can continue on. And then it goes on to say, if the ruler is enlightened, his subjects are in peace, right? Now, who's the ruler? Of course. The ruler here is the heart. So after we go through all of the 12, there are only really 11 lines because the spleen and stomach are together, but after we go through those 12 officials, which are the 12 Zang organs, at that point we go back and the author of this chapter basically reiterates the idea that it's still the heart. The heart is where it's all really at. And if we can keep the heart in a state of enlightenment, in a state of Ming, which is illumination, then everything underneath that is in a state of perfection, in a state of health, right? So here it says, if the ruler is enlightened, his subjects are in peace. And this is a timely political commentary, not only for the Han Dynasty, but for all times, I would say, right? When I was a public school teacher, I just had this conversation with a patient recently. I was a public school teacher right out of college, while I was putting myself through acupuncture school. And I can tell you, I could walk into any school building and within 10 minutes of just watching students interact with each other, looking at the boards on the wall, I could tell you exactly the personality of the principal. And this is, I can still do this. It's one of my secret tricks. I can tell you exactly what the personality of the principal is when you walk into the school building, because it's when the ruler is enlightened. Then the subjects are in peace. Now, in the context of medicine, the ruler is enlightened, subjects are in peace is the heart. And the subjects are all of the organs, the channels, everything, right? So it says, to nourish one's life on the basis of this results in longevity. And this is an excerpt from this end. You can go and read the full chapter. I would encourage you to read the entire chapter by yourself, but this is just an excerpt. Then it says, if the ruler is not enlightened, then the 12 officials are in danger. This causes the paths to be obstructed and impassable. Beware, right? So at the end, it's like, watch out. This is what we're talking about, right? We're talking about this not only in the body, but also in life, in all of life, right? So this is important for us to remember in our personal relationships. If we're in relationships as parents, right? So someone brought up parenting, right? If we're parents, we need to keep this in mind as well. If you're a school administrator in a TCM school, keep this in mind as well. So yeah, the Neijing is important for all sorts of reasons. Yeah, this is chapter 8. This is the secret treatise of the numinous orchid, right? The Median, the treatise on the secret text hidden in the numinous orchid. The numinous orchid is a reference to the library of the emperor, right? Very important chapter. Every acupuncturist needs to read this chapter at least once a month, I think. Okay. All right. That's just the basic background to mind affect. I'm sure I'm preaching to the choir here when I say that this is an important topic for us to consider. So let's go back and review Tung's acupuncture. This will be again a basic review. We did the same basic review yesterday, but I think it's important for us to know a core principle. That way it'll help us understand in a better way why points are doing what they're doing and why we're choosing certain strategies in terms of when we see a patient, what points we're choosing, channels we're choosing, organs we're choosing. So those of you who are brand new to Tung's acupuncture, this will hopefully be brand new. It'll help give us a different idea of why this is a unique systems approach to medicine. And those of you who are reviewing, you can review or step out, have some coffee or tea. So some of the characteristics of Tung's acupuncture that make it a little bit different. These are characteristics that people see from the outside, but these are really mostly outside characteristics. The inside workings, this is T versus Jung, so like theory versus application. This is the end application based on the theory that we'll talk about shortly. So in Tung's acupuncture, we have an extensive use of extra points. Many of them are in locations that don't have points in TCM acupuncture. And I'll say TCM acupuncture as a catch-all for TCM, CCM, it's just marketing difference anyway, Japanese acupuncture, Korean acupuncture, anything based on the conventional 12 channels model that most of us learn in school with whatever small variations there are, Du and Ren, that's what I'll call TCM acupuncture for the time being. So in Tung's acupuncture, we certainly have plenty of points that are in different locations from conventional acupuncture points. Some of the points are overlapping conventional acupuncture points, and sometimes they're used the same way we do in conventional acupuncture. Sometimes they're used in different and novel ways. But most people from the outside, when they see Tung's acupuncture, this is sort of the face of Tung's acupuncture. So we use an almost exclusive use of distal points. And I'll say that they're really distant points instead of distal points. And what I mean is that points usually are not needled into the location of the problem. Now, with something like internal medicine or with mind affect disorders or digestive disorders, this is, no one needles directly into the stomach, no one needles directly into the brain or the heart. They're all distant to the site of disease. This is more sort of obvious when we're doing pain management cases, certainly, where we're needling away from the site of channel stagnation in the area of the body that's uncomfortable. Points are usually almost always needled contralaterally to the site of disease. And again, if we have sometimes digestive disorders, or let's say we have stress-induced disorders, there may not be a contralateral that we can determine, in which case we then can needle one side of the body based on palpation of points, palpation of pulse, or based on, Master Tung would needle sometimes based on gender. So one of the things that we know in Chinese medicine, and if you don't know, you should be clear on this, left side of the body is Yang, right side of the body is Yin. I'm still kind of astounded there are a lot of TCM practitioners out there who sort of reverse that somehow. So many times Master Tung, and not only him, most of my Japanese acupuncture teachers when I was initially training would needle men first on the left side and then women on the right side, although again, that's just a general guideline. So when you needle bilaterally, when you needle unilaterally, to some extent is arbitrary. Bilateral needling is never absolutely necessary, right? If you like bilateral needling, your patients like it, do bilateral needling. If you palpate the points and bilaterally they're both sensitive, you can do bilateral needling. If you want to keep the number of needles down, or if you're tired and you got to go fast, that's okay. Then just do one side of the body. There's not necessarily a hard, fast rule that says this is absolutely when you have to do bilateral needling. The number of needles per treatment in Tung's acupuncture tends to be fairly low. So Master Tung used a small number of needles in practice. I tend to use a small number of needles in practice. This is not unique to Tung's acupuncture. I told the story yesterday in class. The very first acupuncturist that I saw who's still in practice near Cleveland, Dr. Guang, just a TCM guy, and really a TCM guy, not even a CCM or whatever else you call it. He trained at a TCM school in China. I asked him, I was like 19, 20 years old. I asked him, how many needles do you use? And he looked at me and said, if your acupuncturist needs more than 10 needles, don't go to them. Don't trust them. They don't know what they're doing. So that always stuck in the back of my head. Clearly, if you like to use more needles, their patient is not going to explode. But if you're using a lot of needles and every time after your treatment, your patient is exhausted, then it's overstimulation. I also do believe in many cases, at least in my clinic, that a targeted treatment that really tries to address what's going on gets better results more consistently. But that's my experience. You may have different experience based on that. Don't put more needles in just because you're scared. Be confident that what you're doing is good for the patient. Once the patient feels better, leave well enough alone. There's also a use of special point combination and stimulation techniques, including bloodletting. So Master Tung's acupuncture makes extensive use of bloodletting therapy. I like bloodletting more than the next guy. Most of you know I have a book on the topic, and we have videos on the topic for eLotus. There are other great presenters here that do bloodletting as well. My strong suggestion to you is that we will go over bloodletting protocols for material that we have today, because it's hard for me to talk about Tung's acupuncture without at least bringing some of them up. If you are new to bloodletting, you really haven't done it extensively, then this class will not make you competent in bloodletting. I want to be absolutely clear about that. You should take another course that's devoted specifically to bloodletting methodologies, concepts, needle technique, everything. The best thing is to do something in person so that you can have someone, a teacher experienced with it, watch your needle technique, how you're doing it, and how you're dealing with the aftercare of cleaning blood, of dressing the puncture site, all that sort of stuff. And if you're doing bloodletting, whether you're new to it or not, last year or 2 years ago, we did a safety class, a 2-hour safety class. Donna, maybe you can put a link up to the safety class as well. That we did for free. It's available on YouTube for free, so everyone should watch it. You don't have to pay for it. That does bloodletting safety protocols. And I would encourage us to, hopefully I'll try to keep the bloodletting safety course updated as material comes out. And if people have better bloodletting safety protocols, let's share them and get it out there. I am not familiar with all the state's scopes of practice. Make sure you're also practicing when you're within your scope of practice. So questions about your state scope of practice, whether it be California or other places, you have to address to people who know that. If you are doing acupuncture, as I mentioned yesterday, my firm belief is that you should be doing bloodletting, moxibustion, and fine needle, fine as in filiform needle acupuncture. Those are, for me, the big three, right? Bloodletting is more cooling and draining. And we go over this more in the bloodletting class. Moxibustion is warming and supplementing. It can also scatter, of course, because of the heat aspect. And then fine needle acupuncture has a regulatory effect. If you cannot do moxa or bloodletting because of scope of practice, because, I don't know, because if your employer, if you work for some other clinic, if you work for, I don't know, maybe you work for a community clinic where everyone is sitting up, they don't want you to do anything but very basic needling. If you can't do it for whatever reason, you can't do moxa because your landlord won't let you do moxa, then you have to take up the slack somewhere, or you have to do herbal medicine, right? I don't think that every acupuncturist needs to do herbal medicine. I do. I love it. I'm not the best herbalist. I'm not even the 10th best herbalist that I know. There are a lot of people much better than me, but even at my intermediate level of herbal prescribing, patients really do well with it, and we can take up the slack in how we can treat patients. So if you aren't able to do that full complement of therapies as an acupuncturist, including things like gua sha, cupping, or whatever else you're doing, then you must do herbs, in my opinion. I do not think that gua sha does the same at all that bloodletting does. So I know people ask me that question all the time. So, but in Tung's acupuncture, just as a long way of saying, well, we're going to talk about bloodletting protocols, but make sure you have extra training if you need it. Okay, let's talk a little bit about Tung's points. So Dong's points are organized by zone of distribution. This is a little different from conventional acupuncture. Conventional acupuncture, the organizing bucket, basically, the organizing sort of box is the buckets or the boxes of the channels, for the most part, the way that most of us are taught, the way that I was taught. So which means that when we learn lung channel, let's learn lung 1, lung 2, lung 3, where they're located, what do they do, etc. So they're tied together. The common theme that ties them together is that they belong to the same channel distribution. In Dong's acupuncture, we don't necessarily use these same concept of channel distribution as the organizing factor. We use zones of distribution as the organizing factor, right? And so when I mean zones of distribution, we'll see on the next slide, these are the point zones that we talk about. So zones 1 through 10, and then we have the ventral and dorsal trunk, are based on anatomical location of the points. So zone 1 are points distributed on the finger, right? Zone 2 are on the palm, zone 3 on the forearm, zone 4 the upper arm, etc. You can see the rest of the chart. The number of points we'll see in the number of points category column here is the number of points first. The first number is the number of points that were in Master Dong's original book or in some of the other early writing of the Dong authors. Now, one of the things we do know is that Master Dong used more points than what he published in his book. And then students of his continued developing and publishing points, either that they learned from Master Dong or they claim they learned from Master Dong, who knows for sure, or that they developed themselves. And in my opinion, they're equally as part of the system as others. I don't think everyone has to use all of them, but I think reading about them and studying them gives us insight into the sort of underlying dynamics of the system, or the way the specific approach the system tries to exploit and utilize. So the number in parentheses are the additional points that we have in the current edition of our book. That's the practical atlas that I wrote with Dr. Ross in Germany. These are mostly from the Taiwanese literature. And so we put them out there so people can read about them. You know, I think it's, again, I can't say I use all 55 plus 27 points in clinical practice every day, but I find the exercise as an academic exercise of reading about them and trying to see what they're talking about to be useful to me and illustrative in a better understanding of the entire sort of organization of the system. Now, the reason why the zone distribution is important is because each zone functions as a microsystem, which you can see that we mentioned here. So the microsystem concept means that every zone of the body has points that can cover the entire range of the body, right? So zone 1 has points for the entire body, zone 2 has points for the entire body, 3 for the entire body, 4 for the entire body. Get the idea? So that's sort of one of the main concepts that we can see within the system as well. That said, the zones will sometimes have different flavors or different utilization. So we can't say that a point for the kidney, for example, on the fingers, does the same exact thing that a point for a kidney on the leg or the thigh might do. They still treat some aspect of kidney, but exactly what aspect of kidney might be slightly different. So here we have some zone characteristics. So in general, the received conventional teaching is that the zones in the more yang parts of the body, right? So nothing ever escapes theories of yin and yang. I don't care who you're talking about in terms of acupuncture. Yin Yang, 5-phase, these core theories really help explain everything. One of my teachers go back, I don't know how many generations, into the 1900s, is a person named Zheng Qinan. He was the founder of the Fire Sage current. Although I have to say, if reading his books, it's not quite the same modern Fire Sage current in herbal medicine that we see today. But he was, in my opinion, a brilliant thinker. Whether we like his clinical protocols or not, he definitely was a great theoretician. And in the preface of one of his books that he wrote near the end of his life, one of them is called Yili Zhenchuan. So the true transmission, the true transmission of Yili, of medical theory. And in that preface, and I'm paraphrasing, I don't remember the exact quote, paraphrase is that he says, when you're choosing the herbs, the choice of herbs is not really the difficult thing. Understanding the pattern is the difficult thing, right? Then everyone says, yes, of course, understanding the pattern is the difficult thing. And we all sort of like clap and say, oh, we agree with that. And then the next line, he says, wait a minute. It's not understanding the pattern that's the difficult thing. That's easy. really understanding yin and yang is the difficult thing. So everything we do has to go back to core concepts, right? There is no secret technique. There is no special theory. Secret techniques and special theories are for beginners to get them interested in the medicine. People who are experienced at this point, people say, I got a secret technique for you. I was like, I don't need it. Thanks. Tell it to someone else because it's just distraction. All of the core theories were laid down in writing in these early medical texts. And it goes back to yin yang, 5 phases. And that's the secret. There's no other greater secret than just a better understanding of basic material. I'm sorry. So the reason why these zones do what they do is because it goes back to basic concepts of yin and yang. Fingers, hands, and head treat more acute conditions and get faster symptom relief precisely because they're in yang locations of the body. Upper extremities are yang, head is yang. And if we're looking at the upper extremities, so upper extremity versus lower extremity is yin versus yang, right? Yang being top, yin being on bottom. Proximal distal is yin versus yang. Distal is yang, hands are yang compared to shoulder is yin, feet are yang compared to hip is yin. That's all we have to remember, and we understand zone concepts. So the fingers, hands, and heads, because they're in yang portions of the body, get more acute symptom relief, we use them to get the qi and blood moving quickly, right? If we're looking at the lower parts of the body, so in particularly zone 7 and skipped too far ahead. Zone 7 and zone 8, this is the yin part of the body. Zone 8, the thigh is yin of yin, right? If the foot is the yang, distal of yin, lower extremity, thigh is yin, proximal of yin, lower extremity. So they act almost like he points. What is the he point? Nanjing says the he point is where the yang qi enters to the interior. So it has the connection to the interior, to the viscera. Which is why in Tung's acupuncture, oftentimes what we might term root treatment, right? Dr. Wang talks about this in his book, in reference to a letter that he got from, I think, Yuan Guobun, who was one of Master Tung's early disciples. You know, we think of zone 7 and 8 almost as like root treatment zones, with its core organ regulation. And I find this to be very useful useful concept clinically. So there is going to be some difference that we'll see that every zone is not exactly the same. Also in Tung's acupuncture, the trunk, the front and back of the trunk are mostly bled. They're not needled. And we go over why, perhaps, or just talk more about this in our bloodletting class. But chew on it. Think about it. We don't have to answer exactly why everything all the time. The answer exactly why is less important than our thinking about why. You know, it's Confucius in the Lunyu, in the Analects. And I'll just give you the highlight of this quote, because I don't have the Analects memorized. But there's a quote that basically says Confucius gives him like the one corner as a student, and they should be able to, like, the one corner of a table or one leg of a table, and the student should be able to deduce the other corners, right? So there's no way I can tell you the answer to everything, especially in a 8-hour lecture. You know, with my own Tai Chi master, I've been a student of his for 10 years, and I see him almost every week, except during pandemic now. See him almost every week for 10 years, and we spend time, an hour or two together, one-on-one, where he criticizes my form over and over and over again. You know, I know I had arrived one day when he looked at me and said, "You know, chapadwal, not too far off." And I was like, "Yeah, I got there." But you know, all the things that he said to me in a decade, I could never remember all the details. It's impossible. But the details are there to help illustrate the basic concepts and principles, which is why Confucius says give them the one area of the corner and then they deduce the rest. Okay. Yes. So Michael, in Tung's acupuncture, the points on the abdomen are also bled. Now, in fairness, I bleed the abdomen much, much less frequently than I bleed the back. And from my understanding, and certainly I don't know all the Tung practitioners in the world, it seems to me, though, that more Tung practitioners bleed the back more frequently than they bleed the abdomen. You know, I certainly bleed the chest and the trunk, that we definitely bleed. But the points on the abdomen are also bloodletting points. I mean, again, you can needle, there are plenty of TCM points there we can needle, and I do in my clinic, but yes, they're bloodletting points. Right. And Robert in his comment there is also this, that's it. That's exactly what it is. And that was what Confucius tried to get across. So we like to think of the Confucian thinking sometimes as old and stodgy, and you just have to memorize what he said and forget it. But the truth is, he said, no, you got to be a thinker. You have to be a thinker. You have to be able to analyze what you've been given. There's no teacher in the world who can give you all of their insight. It's just impossible. You can't get into the brain of someone else. You get the pieces of the insight that they have, and you have to try to, from that, deduce understanding, experiment with it yourself, research it yourself in the clinic, and then come up with your own unfolding of it. So no one practices Dong's acupuncture. This is a serious point. No one in the world practices Dong's acupuncture anymore. If we're looking at Master Dong, why? Because he's gone. He's not here anymore. The only person in the world who can practice Dong's acupuncture is Master Dong. His insight is passed on to his students. So when I practice Dong's acupuncture, or when Robert practices, or Michael, whoever is on the thing here, when they're practicing Dong's acupuncture, they're practicing Dong's acupuncture through their understanding and experience. And so what I try to pass on is my understanding and experience. And then you can't do exactly what I do. You have to make it your own eventually. And that's it. In Japanese theory, we talk about, there's within Japanese martial arts, some of you may have heard this concept of shu, ha, and ri. Shu means show in Chinese, where you really sort of guard. You basically, you're taught what your teacher says. You have to hold on to it as best as you can and try to study. Ha, the second part, is po in Chinese, means to break, which means then, after you've understood that, then as a student, you have to sort of think, maybe the rigidity that I was taught it's there just as a teaching tool. It's not reality. Then we can break with that rigidity so as to really start to understand, how can I really think about what's happening? First step is mimicking. The second step is really thinking about it. Then the third one, ri, is like li kai in Chinese, meaning to leave, which means then it's your own. Okay, that's shuhari in Japanese concept. All right, maybe we'll do a class on education theory someday. All right, let's go on. Let's talk a little about core theory. So let's talk about acupuncture. Acupuncture is this black box event. We talked a little bit about it yesterday. So we know we have this area of the body we can apply stimulus, and on the other end, after stimulus, we get some sort of response. But the causal chains that get us from stimulus to response is really unknown. I mean, we have theories, whether they're Chinese medical theories, biomedical theories, but they're still theories. The absolute nature of reality is something that will probably escape me as long as I inhabit this body of this incarnation of flesh, and I'm fine with that. So what we need to do is come up with some sort of theory that helps us understand the causal chains it gets from needle location to indication or result. And the best theory is one that tries to do this in a consistent way so that our results can be as consistent as possible in the clinic, within the sort of reasonable bounds of people are individual and unique, and results will vary slightly from person to person. So the best model that I can explain, and the best model that, this is an idea that Dr. Ross started articulating, my friend and colleague in Germany, when we were teaching this material together over the years. Because Dr. Ross, the co-author of the Practical Atlas, he's a Western scientist. He didn't start learning acupuncture probably until he was in his late 50s, early 60s. And for the rest of his entire career, he graduated from medical school at University of Vienna. So a serious Western medical doctor, a tenured professor at University of Dusseldorf in the medical department. So he was trying to wrap his head around acupuncture and try to figure out, how can I use a theory that gets me from location to results, needling to results. And as scientific as he is, and as fascinating, he's fascinated with potentially what are biomedical mechanisms. I don't care as much about the biomedical mechanisms because I'm a clinician. The how it works, I don't care. As long as it works, that's the most important thing to me. But he's the one who says, who really articulated that the best theory that he's ever seen, even as a biomedical physician, is a theory that we have from classical Chinese medicine, or just Chinese medicine. I try not to use the word classical Chinese medicine. So that theory is rooted in this concept that heaven, earth, and humanity are in harmony, and that we as humans are a microcosm or a hologram of the natural world. And this is a major theory that the early medical texts, including the Suen, the Lingshu, Nanjing, not to the same extent, but it definitely is based on these same concepts, reiterate over and over again. So the reason why there's yin yang in 5 phases in my body is because there's yin yang in 5 phases in nature, right? The ancient thinkers in China deduced these patterns by observation of the natural world, and they existed as theories that describe the natural world, the political reality, for centuries before they were applied to medicine. It was the genius of the authors of the Neijing and the Nanjing, these early classics of medicine, that they started applying these theories of reality, theories that were derived from natural observation, to the human body in the practice of medicine. The reason why it works is because it's simply how the universe works, right? At least in that way of describing it. So we are a small heaven and earth. Zhang Jiabin said that our human body is a xiao tiandi, a small heaven and earth. We saw a quote from him earlier on that related to what Shen mean. So if we are a small heaven and earth, that means that it's the Chinese articulation of the Hermetic principle of as above, so below. So we are created in the image of the universe. And if we believe that concept, we can also see that our body, smaller parts of the body, are also images of the whole, right? So the information in small parts of the body is like a hologram. Think about those of you who are, we're totally all fractals. Think about, the Star Wars, where it's Obi-Wan is talking and it's a hologram of Obi-Wan, looks just like Obi-Wan, sounds like him, it moves like him, but it's a small little version of him. That's us. We're the smaller version of that. And if we're the smaller little version of that, each small part of our body are smaller little versions of us and that, right? This is the entire principle behind Chinese medicine diagnostic methods. Tongue diagnosis works because it's a small representation of everything, right? Ear acupuncture works because it's a small representation of everything. Pulse diagnosis, pulse is not complicated. Pulse is just, let me get basic ideas of yin and yang and how it connects to everything in the body through this image of a little hologram, right? None of it is complicated. It's just a matter of gaining experience touching bodies and making those connections through our own powers of observation. Right? It took me years to really, as I was a very good student, I did exactly what I was told in the beginning, because that's how I learned. I was trained initially as a classical musician. I had to do exactly what my teacher said for like a decade before I was allowed to think about anything for myself. Because until you get your fingers on the instrument and master it to a place where it becomes part of you, you can't make it sing as a real piece of art, right? Same thing with Chinese medicine. You have to get all of the information under your fingers so that it's so ingrained in your way of thinking, and then you can sing with it. It's really beautiful afterwards. So back to then this idea of microsystem. When we're doing diagnostics, nothing is complicated. It's all actually relatively simple, because it's all basic representation of core principle. People who find pulse diagnosis difficult or palm diagnosis or tongue diagnosis difficult, it's because we just have to go back and review basic concepts again, which is not to be, scolding anyone. It should be like, oh, that's great. It's beautiful. When I don't understand something, it just reminds me, I just got to go back to the basics. It's not that we have to learn anything complicated. So within the body, we have all of these relationships of the small to the large that we then can exploit for therapeutic benefit or for diagnostic benefit. That's the core principle. At least that's, in my opinion, one of the main ideas that we need to look at. We can look at it through other angles, but this is the idea that I find as a teacher is most useful in getting the material across. My goal as a teacher is to have you do what I do better than me. Because if I'm the best, then that's really sad, because there can be a lot better than me through the next 10 years, 100 years, 1,000 years. We want to make it better and better. Every teacher should have as a goal to create better students than they were. That's if the teacher doesn't want that, don't go study with them. Okay. So let's look at some of these connections to try to understand some of the basic concepts that we'll be playing with as we go through points and protocols. And again, I'm sorry for those of you who are, this is a review, but that's okay. So some of the things we're going to talk about are various different kinds of correspondences. So this idea of connection and correspondence, I think, is deeply embedded within Chinese medicine. It's deeply embedded in everything, really. So the correspondences that we'll talk about today are holographic correspondence, channel correspondence, and tissue correspondences. There are other ways of breaking the material down, but this is what I find particularly useful, and I think is most useful when teaching and trying to get the material across. And keep in mind that when we're looking at any of these, none of this is unique to Dong's acupuncture, right? Because this is all based on core concepts that exist in other systems of acupuncture, in not even only acupuncture. I'll make a little mention as we get to holographic correspondence. So in holographic correspondence, we're going to look at two levels. One are the large Tai Chi holograms and one are the small Tai Chi holograms. These are not the only ones we can look at, but again, I think the most useful for people really trying to dip their feet into the system. In, large Tai Chi holograms, the body's mapped out onto other large regions of the body, where limb goes to limb and trunk goes to limb, and we'll see examples of that. Elbow and knee will be the pivot points. The small Tai Chi holograms are the body mapped out onto small parts of the body. So the ear, for example, is a small Tai Chi hologram, right? The entire body in a small part. Tongue is a small Tai Chi hologram. Pulse diagnosis is a small Tai Chi hologram. Like abdominal acupuncture, I think I love abdominal acupuncture, the abdominal microsystem, absolutely fascinating. That's the kind of stuff I absolutely love. Also a small Tai Chi hologram. Get the idea? Let's look at some examples. So this is the correspondence of arm to leg. Those of you who studied before with Dr. Tan will find this familiar. I will also make sure that this is understood that this is not unique to this is not unique to balance method. This was not created by balance method acupuncturists. It's also not even unique to Dong's acupuncture. This is something that's sort of built into the system that other systems of acupuncture talk about. Some of you may be familiar. There's a recent publication by Liu Lihong in China. It's a book called the Huangdi Neizhen, the Yellow Emperor's Inner Transmission of Acupuncture. And it's actually one of the best books on acupuncture I've read in a long time, although it's Dong's acupuncture. Even in the preface, the preface says these principles are found in other traditional acupuncture systems. But in this system of acupuncture from mainland China, this concept is at the heart of their approach to acupuncture. So this is not unique to Dong's acupuncture. This is just acupuncture, right? So this is in the public domain. No one owns this. This is for everyone, okay? So here's the idea. The shoulder goes to the hip, the elbow goes to the knee, and the hand goes to the foot. We talk about this, and I've talked about this for a long time in Tai Chi theory and practice. In internal martial arts, we call this the Lyoucho, the six harmonies. So we talk about the San Wai He, the three external harmonies. And that's the shoulder goes with the hip, the elbow goes to the knee, and hand goes to the foot. Same thing. This means that there's a resonance. There's a connection between these analogous structures. And what that then translates to is if we have a dysregulation in the circulation of qi and blood, let's say in the elbow, by applying a stimulus to the knee to a resonant analogous structure, that we can then mobilize qi and blood in the location of the elbow. This specific type of projection is most commonly used for pain management. Why? Because we're just using the limb to treat the other limb, right? So we go into much more detail on this in our pain management classes. So I would refer you to that, encourage you to go look at some of those classes to see some of the application of this. Now, since nothing escapes basic concepts, nothing escapes yin yang and 5 phases, let's go back to yin yang. One of the things that we notice is that yin and yang mutually can treat each other. They mutually attract. We have basic concepts of yin and yang, and one of them is that yin and yang are mutually rooted in one another. So in the Su Wen, it says the superior acupuncturist treats right from left, left from right, leads yin from front to back, back to front, leads yin from yang and yang from yin. I don't know about you, but I want to try to be, aspire to be. I don't think I'm the superior acupuncturist, but I aspire to be as good of an acupuncturist as I can. So this is what I want to try to embody, at least one of the ideas I want to embody. So notice that if we're using the shoulder and the hip as being resonant structures, proximal and proximal are both yin, right? Proximal and distal is yin versus yang. Distal is yang. So foot and hand are both proximal. They're both yang. So in this projection, we're using yin mapped to yin and yang mapped to yang. As I said before, not so sexy, not so exciting. So because yin and yang are mutually intertwined, we can use the yin part of one limb to treat the yang part of the other limb, right? That's a theoretical basis. And because yin and yang is a theory that works, this works. So here we can see that the hand can also go to the hip and the shoulder can go to the foot because of this idea of interconnected yin and yang. Okay, so this still means that the elbow and the knee go together, but if I have a problem of the hip, I can now use the hand to get to the hip instead of the shoulder, or I can use the shoulder to get to the hip. In the end, we choose the points based on what points we know are useful for what condition, and then by palpation and observation, because patients are all different. We can't assume that the same theory will be equally applicable to every patient in every clinical encounter, which is why we have to be observant of our patients. We need to look, we need to palpate, we need to ask, right? And then gauge response. Okay, so far so good. Let's go on to the next projection. This is the projection of the upper limb to upper limb and lower limb to lower limb. Same idea. Shoulder can go to shoulder on the opposite side because what does the Suen say? Right from left, left from right. Hand to hand, or we can invert the relationship, which means we can use the shoulder to treat the hand and vice versa. So there is a set of points, for example, on the back of the shoulder that we use frequently to treat things like hand pain or carpal tunnel syndrome, and it works wonderfully. So in the leg-to-leg correspondence, yes, the hip goes to the hip, foot goes to foot, or we can invert it. Then it's the foot goes to the hip and the hip goes to the foot, right? So even in TCM, we use points like gallbladder 30, right? Jumping circle to treat problems of sciatica with pain going down the leg, down the foot. And it's not only because the sciatic nerve goes down there, it's also because that hip can treat further down on the lower extremity, right? Or we use gallbladder 41 to treat hip pain. Same idea, right? So there are lots of different ways we can sort of look at and take apart the material, but this is certainly one way that's useful for us to sort of conceive of. Now, the problem is both this distribution and this distribution don't allow us to treat internal organs or to treat the trunk or the head. So we need a distribution that does this, and that's this one here. Here we can see same thing based on yin and yang theory. None of this is unique, and none of this is a state secret. It's all just basic information. So since the foot and the hand are yang, they go to the head. So yang goes to yang. Or yin goes to yang. So then the shoulder and hip can also go to the head. So we can basically map out the same orientation. Again, head goes to hand, neck goes to wrist, upper trunk goes to forearm, elbow goes to navel level, and down the shoulder goes to lower part of the trunk. We can invert that orientation, and we can look at the leg. Foot goes to head, knee goes to the navel level, up to the hip goes to the lower part of the trunk, and we can also invert that relationship. So it's these ideas that we can take to help understand why certain acupuncture points have an affinity with different parts of the body. My suggestion to you as a type of homework is once a week, go into Deadman, and I give this to my students who actually have to do homework for me. You guys don't have to do homework for me. This is your voluntary homework. Choose a point in Deadman or whatever acupuncture book you like. Read the point, look at the location, look at the indications, not the point functions. Take the point functions and throw them out. Look at the diseases that are traditionally associated with that point and try to map all of those diseases from that point to the target. Throughout the local stuff, every point has both local action and distant action. We're worried about the distant action. That's your homework. You can email it to me later. Email it to Donna. Donna will be grading your homework. So you use all of the correspondences. And my suggestion is we're not doing this to randomly choose whatever point we want for indications that are not commonly seen. So we'll get to this topic shortly. My suggestion is that we're using this so as we can understand the point functions. Okay? That we'll come back to that concept again. All right, everyone okay with that so far? Let me see where we are. Let's just do the small Tai Chi, then we'll take a little break. So the small Tai Chi is the whole body mapped out onto different parts of the body. Just before that, so Kenneth 7708, which is stomach 36, treats heart and lung, but you have to ask yourself what aspects of heart and lung function potentially. So we need to know, we'll talk about needle depth, but we need to think about what are the symptoms present in that, and that helps elucidate also the microsystems, right? So we can see any point within the large Tai Chi or small Tai Chi microsystems, and understanding all of so you go back and look at the disease listed, the symptoms listed, so go look at stomach 36 and read because stomach 36 has lots of symptoms. Go read all the symptoms under stomach 36 and try to map every symptom from that point to that symptom. Don't worry about the point functions, worry about the symptoms and the disease names, and try that mapping, and that will teach you all of the ways of looking at the hologram correspondences. Okay, so the small Tai Chi is definitely not unique to Tung's acupuncture. This was described by a lot of different authors, including the Korean hand acupuncture system, ECIWO system. There are books on ECIWO. I know someone asked a question about embryological development. We're going to leave this to Professor Jung. Read his own books and he'll explain it much better than I can in a 2-minute blurb. But the basic idea here is that small parts of the body can map to the larger parts of the body. So the first diagram we have is from Professor Jung. This was the first microsystem that he discovered, which he called the second metacarpal microsystem, which you'll see this in books on Tung's acupuncture without citation. It's not Tung's acupuncture. It's from Professor Jung. But it is Tung's acupuncture because acupuncture is acupuncture. Don't forget that. So here we can see along the second metacarpal, the entire body can be mapped out because that one long bone is an image of the entire body. So we can see diagrams such as this. This is the tibia, right? The entire tibia can be upper jaw, middle jaw, lower jaw, right? In Tung's acupuncture, we know that there's a set of points along the ulna. This one is called Shinmen, heart gate. This is Ganmen, liver gate, and Changmen, intestine gate, right? I don't remember the numbers. We'll talk about why I don't remember the numbers shortly. But it's clearly upper jaw, middle jaw, lower jaw, right? Upper jaw, middle jaw, lower jaw. This is a theme that we see not only in Tung's acupuncture, but throughout many ways that we can sort of hash out conventional acupuncture points as well. So we'll use this distribution to also help understand why certain points do what they do. Think about spleen 6, right? Sainin Jiao, 3 yin meeting. Spleen 6, you can see my cursor here, goes to the area of the abdomen, right? Go back. Oops, sorry. Here, spleen 6 maps to the area of the lower abdomen. Some points map to certain areas of the body over and over and over again. And I'm going to suggest that maybe that's a stronger connection that really means like spleen 6 is really good for gynecological problems. Doesn't matter if you do Tung's acupuncture, conventional acupuncture, it's really good. There's a reason why it's really good because of all the connections. The more connections through channel, which we'll talk about after break, and through image, the stronger the relationship is, the more clinically effective that point is, in my opinion. Okay? So that's the small Tai Chi hologram. So we see it there. We see it on the face, right? Upper jaw, middle jaw, lower jaw. The ear is the same thing. So on the tongue, upper jaw, middle jaw, lower jaw. These are all small Tai Chi holograms. Okay. Everyone happy? We're okay? No one's asleep yet? Let's take a little break here. Donna? give us a time, come back, we'll do 15 minutes. Get up, move around, have a little tea or coffee, a little snack if it's that time. Those of you, welcome to those of you in very, very far-flung time zones. My apology if you're up really, really early or really, really late. But let's come back at 10:30 Pacific time, 1:30 Eastern time.